If you're a really good scientist and you want to do something for the benefit of patients, well, you're in the busiest medical center in the nation. For quaternary care, for cutting-edge science, you can do it all here in the medical center. You can't underestimate the importance of having a research enterprise that is right with your clinical enterprise. We have discovery science that can be translated to patient care and improvements of health. You can't do that any place without a relationship with your hospital, and we have that at Baylor St. Luke's Medical Center.
Baylor St. Luke's is a quaternary center. We offer those type of advanced services that no one else is able to offer. Cardiovascular services, including heart transplant at Baylor St. Luke's, is, in my opinion, second to none. This is where Denton Cooley performed the first heart transplant in the United States. First artificial heart in the United States was put in here. And right now, we're in trials to put in the next generation of artificial hearts that are going to be transformative. So we have a long legacy of pioneering activity in the heart transplants world, but also lung transplants, liver transplants, kidneys. Our Dane L. Duncan Comprehensive Cancer Center is one of our other key service lines. We're one of 3 NCI designated comprehensive cancer centers here in Texas. And what that means is that our patients have access to the most advanced treatment protocols, techniques, anywhere in the country. Being an academic medical center, part of that is research.
One of the things that people may not know about organizations that are a part of the Texas Medical Center is how we really do all strive towards a mission of continuing care research.
Texas Children's Hospital has been affiliated with Baylor College of Medicine for over 60 years. It's the academic partner. And this partnership is fantastic because it draws on the greater expertise within the larger Baylor College of Medicine faculty. Because of the concentration of clinical expertise and incredible research here, there's nothing one cannot do. If an investigator starts their career here and they encounter a tough medical problem, the colleagues around them within the TMC institutions will immediately come to help.
There are sometimes that physicians out in the community and patients and their families are really left with an unanswered question. There are specialists that are able to really spend a lot of in-depth time and really solving the problems that our patients have had unanswered questions to.
In the 80s, a revolution started in the Texas Medical Center. And that revolution was the genetic revolution, starting first by understanding causes of diseases gene by gene, to quickly helping map the genome, to discovering the causes of so many neurological and other developmental disorders. And all these first happened here in the Texas Medical Center. So having been the ones who discovered the causes of so many neurological diseases in the early 90s, we are the ones now leading the way to develop therapies for these disorders.
Genetics is really continuing to grow as far as its application to the clinical world. And Baylor College of Medicine and Baylor St. Luke's is at the forefront of that. We are able to have individual treatment plans based on people's molecular genetic makeup. There are some medication treatments that may not be helpful for one person with a genetic makeup, but for another, they're exactly what's needed.
The time is now to develop therapies for as many diseases as possible. The technology is such that soon we're going to have every disease possibly treatable. And many diseases we once thought not reversible, we are learning are actually reversible.
I have a great appreciation for the miracles of Texas Children's and the incredible research and clinical care that is delivered with its partnership with Baylor College of Medicine because of my children's DNA. They were born with rare genetic syndromes. I have experienced the importance of basic science research really translating into clinical care and working with industry so that we can transform the world's toughest challenges and really turn those into miracles.
One of the great things about an association with an academic medical center is we have translational scientists who are really pushing the envelope of cutting-edge medicine. As an example, Olivia Eberlin is an associate professor of surgery, and what she's developed is a pen that can be used during surgery that can identify cancer from non-cancer tissue. Normally, you have to send that off and wait, sometimes 45 minutes to get a tissue response back from pathology. She can do it instantly. Gabe Lohr, one of our pulmonary surgeons, thoracic surgeons, he's the lead investigator studying how we can preserve lung tissue sort of in a box with perfusion and ventilation so that you get better outcomes with lung surgery and have some of the best in the nation. We have Samir Sheth, who's a neurosurgeon working on deep brain stimulation to change OCD, obsessive compulsive disorders, and depression. Dr. Ken Leal has done 600 minimally invasive surgeries for the heart through robotics. So this is the kind of stuff that is moving the envelope of medicine, and it's happening here.
St. Luke's and Baylor College of Medicine are hand in hand with driving the success of this organization. Everything from quality of patient care, patient safety, the innovative clinical trials that they bring to our organization, the clinical experts that they bring to our organization. It's not just here at Baylor St. Luke's. Our experts here add to the clinical knowledge, protocols, care paths across the greater Houston area and even Texas and beyond.